Something quiet but deeply unsettling is happening inside one of the most powerful institutions in the country, and most people won't realize it until money starts disappearing from their checks. The Social Security system was built on a promise that after decades of work, contributions, and trust, there would be a safety net handled with care and human judgment. That promise is now being tested in ways that feel invisible at first, but devastating once they hit real lives. Inside the agency, a shift is underway that changes how decisions are made, and more importantly, how quickly they're made without human review. Starting this year, major benefit decisions are being pushed through automated systems with little to no oversight. Applications that once required trained staff to pause, double-check details, and flag potential mistakes are now being approved or processed with a simple digital confirmation. No call, no clarification, no safeguard, just a button being pushed. The most immediate impact is showing up in Medicare filings. When someone turns 65 and applies online, the system no longer reliably checks whether enrolling actually makes sense for them. In the past, a real person would review the application and notice red flags, like whether the applicant still had health coverage through their own job or a spouse's employer. That mattered because Medicare is not automatically required in those cases. Today, those checks are being skipped. The application goes through, coverage begins, and monthly premiums start getting deducted, whether the person needed Medicare or not. That single oversight can quietly cost thousands of dollars over time. Medicare Part B alone carries a monthly premium, and once someone is enrolled, undoing that decision is not simple. Many people sign up believing they have no choice, only to learn later that they were charged for coverage they never needed. The system doesn't treat that as an institutional failure. Instead, the responsibility is pushed back onto the individual, as if everyone is expected to master tens of thousands of pages of policy on their own. This isn't limited to Medicare. The same automation mindset is being applied across disability and retirement claims. Employees are being given less time to help applicants, sometimes losing 15 to 30 minutes per case. That time used to be critical for people with complex situations, multiple doctors, incomplete records, dependent children, or gaps in earnings histories. Those details don't fit neatly into automated forms, and when they're rushed or skipped, the consequences follow the applicant, not the system. Even calling for help is becoming less effective. Phone access to trained staff was once part of what workers paid for through decades of payroll taxes. That service is now being hollowed out. Instead of careful, individualized guidance, the new expectation is speed. Move the caller along, direct them online, and let the system auto-process the claim. If something goes wrong, it's treated as user error, even when the process itself made accuracy nearly impossible. Behind the scenes, there were even discussions about assigning staff an impossible workload, up to 7 retirement appointments per hour, not to resolve cases, but to tell people to file online and move on. Once submitted, those applications would be automatically adjudicated without a second look. Missing earnings, wrong benefit type, filed too early or too late, the system doesn't stop. It finalizes the decision, and the financial impact becomes permanent unless the applicant knows how to fight it. All of this represents a fundamental shift in how Social Security operates. The emphasis is no longer on protecting people from costly mistakes, but on moving claims through as fast as possible, regardless of accuracy. Automation is being positioned as a solution, but in practice, it's removing the very human judgment that once prevented life-altering errors. And the people most affected are often the ones least equipped to navigate a system that no longer pauses to ask whether the outcome actually makes sense.
The automation push doesn't stop at Medicare or retirement claims. It extends deep into disability filings, where the stakes are often survival-level serious. Disability applications are rarely simple. They involve long medical histories, multiple doctors, detailed timelines, and in many cases, dependent children who may also qualify for benefits. These cases used to receive extended attention because missing even one detail could delay or derail approval for months or years. That buffer is now shrinking fast. Internal changes are cutting down the amount of time employees are allowed to spend helping someone file a disability claim. What once took careful back and forth is now being compressed into rushed sessions, sometimes ending before all relevant information can even be entered. When the clock runs out, the applicant doesn't get a follow-up. The case simply moves forward incomplete. And once it does, fixing errors becomes exponentially harder. This speed-first approach is also redefining what customer service even means inside the system. Workers are no longer encouraged to guide people through decisions. Instead, the unspoken rule is efficiency over accuracy. Get through the interaction, reduce the queue, push the application online. Let the system handle the rest. The irony is that Social Security was designed as a prepaid service. Workers funded not just their own benefits, but the infrastructure meant to help them access those benefits correctly. That infrastructure is now being dismantled piece by piece. One of the clearest examples is retirement filing support. People with gaps in earnings histories, missing employer records, or dependent children often need careful corrections before filing. Those corrections can directly change monthly benefit amounts for life. Under the new system, those nuances are treated as inconveniences. If the issue can't be resolved quickly, it's often left unresolved. The application proceeds anyway, locking in lower payments that the recipient may never realize they're entitled to challenge. What makes this more troubling is that there's no parallel effort to educate the public. The expectation seems to be that individuals should already know which benefit to file for, when to file, and how different choices permanently affect their income. The official fallback answer is usually check the website, despite the fact that the rules span tens of thousands of pages and are filled with exceptions, conditions, and irreversible deadlines. This creates a system where mistakes aren't just possible, they're predictable. And when those mistakes happen, responsibility is quietly shifted away from the institution and onto the individual. The system assumes informed consent, even when informed guidance no longer exists. In practice, people are being processed, not helped. Layered on top of this is a broader political reality. Staffing shortages and service declines didn't happen by accident. Reduced funding leads to worse experiences, which leads to public frustration, which then gets used as evidence that the system itself is broken. That narrative makes it easier to argue for privatization or restructuring, even though the dysfunction was engineered through neglect. The end result is a feedback loop. Worse service fuels mistrust, and mistrust justifies further cuts. As automation replaces human judgment, the system is becoming less forgiving and more opaque. Decisions are made faster, but appeals take longer. Errors are harder to trace, and accountability becomes blurred. What used to be a safety net is starting to feel like a maze, one where the exits are harder to find and the cost of a wrong turn can follow someone for the rest of their life.
The consequences of this shift don't always appear immediately. For many people, the damage shows up months or years later, when a benefit amount feels oddly low, when healthcare costs seem higher than expected, or when a letter arrives explaining a reduction that was never clearly agreed to. By then, the system treats those outcomes as settled decisions, even if they were triggered by rushed processing or incomplete information at the start. This is especially dangerous for people navigating needs-based programs alongside Social Security. A small change in income, a one-time inheritance, or a delayed report can ripple outward, affecting Medicaid, supplemental income, or housing assistance. These programs are interconnected, but they aren't coordinated in a way that protects recipients from accidental non-compliance. The responsibility to report, calculate, and justify every change rests entirely on the individual, even as institutional support continues to shrink. What's striking is how little flexibility exists once automation has made a decision. Human discretion used to allow for context, temporary income, necessary expenses, or honest misunderstandings. Now, eligibility checks and benefit determinations are increasingly binary. Either the system flags an issue or it doesn't. And when it does, the burden of proof falls on people who may already be dealing with illness, financial stress, or age-related limitations. At the same time, misinformation continues to spread. Many people believe certain taxes no longer apply or that benefit rules have fundamentally changed, when in reality, the underlying policies remain largely the same. What has changed is how aggressively the system enforces them and how little assistance is available to explain the fine print. If someone miscalculates income, misunderstands taxability, or assumes a deduction changes how benefits are counted, the system doesn't correct them, it simply adjusts the outcome. Even family dynamics can complicate things. Former spouses, current spouses, and multiple claims tied to a single work record are all legally permitted under specific rules. These situations are lawful, common, and accounted for in policy, but only if someone knows how and when to apply. Automation doesn't ask clarifying questions. It doesn't explain trade-offs. It processes what it's given and moves on, regardless of whether that choice was optimal or even appropriate. The deeper issue is that Social Security was never meant to function as a self-serve platform. It was designed with the understanding that people would need help interpreting rules that affect their lifelong income and health care. Removing that guidance doesn't simplify the system, it shifts risk downward. The institution protects itself through efficiency, while individuals absorb the cost of errors, delays, and misunderstandings. What's emerging now is not a sudden collapse, but a quiet erosion. Benefits still exist, payments still go out, but the margin for error has vanished, and the safety net has fewer hands holding it up. In a system this complex, speed without judgment isn't progress, it's a gamble, and the people placing the bet aren't the ones who will pay if it goes wrong.